So there was, in the Menopause Summit, I completely forgot who was presenting now.
Yeah.
But there was, it resonated with me about the cycle and the phases of life. And then there's she called it the menopause circle, I think. And then there was, and there was a lot of talk, because we always talk about hormones.
Yeah.
We don't talk about the physical aspect.
Yeah.
To support that phase. We don't talk about the mental and emotional aspect.
Yeah.
And the things we can do under that, right?
Yeah.
And there's the, obviously, so hormonal, physical, mental. There's one more. There's the community aspect as well.
Mm-hmm.
So she drew this very beautiful circle where she said, all we think about is, when do I start my HRT and the hormonal aspect, as if that's the cure for everything.
Yeah.
And we kind of ignore the physical, we ignore the psychological, we ignore the power of the community into all of this.
Yeah.
And I really want to talk about this because it's not a magic pill.
No, it's
right?
Weight gain. That's one thing. A lot of women are like, I want to start HRT because I'm gaining so much weight around my center.
Yeah.
HRT isn't sudden.
It's not Manjaro. And we're there to Manjaro.
Yeah, I knew you were going to ask me. But no, exactly what you're saying. It's more than you need to really start prioritizing yourself. And prioritizing yourself does not just mean medication.
Yeah, popping in supplements.
Exactly. It's the weight training, it's the Pilates, it's education by your inner circle, getting to know like-minded people who may be going through the same transitions in your life. There's some women who I notice they're so much better educated and so much less afraid because their friends are also going through the same thing. And it's a bit of a joke, amongst their friend group that like, we're going through all of this together. Yeah. And that those women, not that I want to say suffer a lot less, but those women just, they're transitioning with a bit more grace. and less fear. It's so important. We as people, we're meant to be in tribes. We're meant to be in a village.
To belong.
Exactly.
To have common purposes.
Yeah. We're not meant to be isolated and just going to a doctor's appointment for 20 minutes and then being like, okay, I've checked off my wellness list. That's not the case. I'm a tiny player in, like I said, the tapestry of health. So yeah, I always tell women, like, you've never worked out before? Great. Now is the time to start. Like, it's never too late. And actually, the benefits of working out is going to classes and meeting people. Like, maybe they're going through similar things. And
100%.
You start actually noticing that you're stronger. But I always tell all of my patients, I don't want you to be skinny. I want you to be strong, because when you're 80, the difference between a good 80-year-old and a bad 80-year-old who's in and out of hospital is their strength.
That's it.
If you can...
And mobility.
Mobility too, Mobility is so much.
I'm very big on mobility.
I'm very big. So, obviously, when they come and see me, I think they're a bit taken aback because they're like, I came to you for HRT.
Exactly. And then you're preaching me about my lifestyle. Can you just give me the HRT?
Yeah. Or I have some patients who want Manjaro and they're 55 and I'm like, let's look at the bigger picture here. You're gaining a lot of weight, but this is what we expect in the, there was a SWAN study that I've spoken about in talks before.
Yeah.
That basically showed that the average woman between perimenopause and menopause will gain 1.5 kg per year through no fault of their own. If you're perimenopausal for 7 years, that's over 8 kg, 9 kg that you've gained. And they think that I'm just going to take this Manjaro and I'll get to my goal weight and khalas.
It will deal with itself.
It's actually...
And in fact, matter of fact is you're losing muscle.
Exactly.
You're not getting any stronger, that's for sure.
Less protein.
And whoosh, going downhill.
Yeah, so not that I'm bashing Manjaro.
No.
Manjaro is great, but in the, Manjaro has its benefits in that it reduces inflammation. If you're diabetic, it's great at glycemic control. For some people who are, in the obese category, it's fantastic at getting you to where you
need help.
Yeah, exactly.
Yeah.
But just for a 65 kg woman who's getting sensual weight gain, who wants to lose that sensual weight gain.
And that is a bigger portion
of Dubai.
Of Dubai. I don't know about the world. I mean, we live here.
Yeah.
But I feel like this is a global thing now.
Yeah, it is.
We have extended family all over. So it's like everybody's on it, you know? And I'm like, guys, and, you know, again, we're not saying don't do it.
Yeah.
I'll never say to anyone, don't do something.
Yeah.
I'm just saying,
guided by your doctor.
Thank you, one.
Yeah.
And two, as long as it makes sense, if you are pre-diabetic, then yes, definitely you need to be on it.
Yeah.
Right? And if you're morbidly obese, of course, it'll help, right?
Yeah.
But don't do it for those 2 kgs, please.
Yeah.
Right? Like,
2
just
kg that you could... A lot of it is misinformation as well. Women think that...
I'm very micro-dosing. I hear this a lot.
Oh, yeah.
I'm micro-dosing only.
Yeah.
So that's allowed. Like, that's okay.
Maintenance.
Right? And I'm like,
yeah.
I don't know.
Yeah, and I think, again, mobility. Manjaro doesn't give us mobility. It doesn't give us flexibility. It doesn't give us strength.
Yeah.
So, yeah, stay on your Manjaro, but then a bigger portion of what I wish for women is that we start focusing on strength. You know, back in the day, it was seen that, like, why weight train? I don't want to be muscly. You know that?
Yeah. I don't look like a guy.
Yeah.
We still hear it every day. We still hear it every day.
I want to be soft and waif-like and Kate Moss. And I grew up in the era of Kate Moss where skinny was the most important
thing.
But actually, the thing that I notice in the health sphere is that hospitalization, if you're hospitalized with a pneumonia, for example, at 70, but you work out regularly, your lung function is likely better. Your metabolism is likely better. You're much likely to recover faster than someone who just sits on the sofa all day. So, yeah, I think, like you said, menopause it's a good analogy, actually. It's a circle of life that you need that support. You need the whole
of this. And you need to look at yourself beyond the hormones only.
Yes.
I think you're a human being.
Yeah.
And it gets to me when we're labeled as, oh yeah, you know, the hormonal person came in, right? We get that all the time. I'm in corporate. I'm in a very male dominant industry, so used to it, to that sentence. Unfortunately.
Yeah.
And it's used very sarcastically and very lightly.
Yeah.
And I don't think people who use these statements understand how ridiculous they are. Yeah. But then that's another story.
Yeah.
But I think as we look at ourselves, yes, hormones and fluctuations is a big part of us. But there's so much you can do outside medicine.
Yes.
That will help you.
Yeah.
That will help you reduce the symptoms. So one of the things when we talk psychology, for example, so yes, health and fitness and physical is so important, right? And we will get to the bone density and all of that. But stress management.
Yeah. Having a place, like a hobby. A lot of women are growing up without hobbies. It's like, work is me.
That's it. Or children is me.
Yeah.
And that's it, right?
Yeah.
And at 40, right? Or the perimenopausal area, you're probably, so if you're in a career, you're probably at the highest highlight of your career, which means you're in a leadership position, which means more stress.
Yeah, exactly.
Right?
More decision making,
more work, more working hours.
Yeah.
Full stop, right? So are you doing anything different?
Yeah.
Most of the time, the answer is no.
Yeah.
Right? If you're a stay-home mom, then the kids are starting to get older.
Yeah.
Yeah? And they're starting to, like, not really out of the nest as yet, but they're getting there. And they're getting independent, and you're feeling useless at this point, right? I'm sorry.
No, don't worry.
So you are feeling stressed again, right? Are you doing anything about this?
Yeah.
Because the more you do today, and this woman was making me think when she was talking about it that way, I'm like, I'm so stressed. I'm so stressed. Yes, woman, yes. Right? And how am I dealing with it better and dealing with it more, right? How do I become better at dealing with the stress? What are the things that I'm doing? Am I getting therapy? Am I talking to somebody about it? And the answer last year at the summit was no.
Yeah.
The first thing I did, okay, I need a therapist.
Yeah.
Like, I need to handle the stress that I'm living unconsciously.
Yes. Yeah.
Because we go into life so busy.
Yeah.
We're like, yeah, let's get it done.
Yeah.
We're so strong.
Yeah.
Right? And then we ignore
Yeah.
all of that. And guess what? It comes and bites you 6 years down the line. Because when the real symptoms hit in and you haven't dealt with the stress management or the psychology of things that, you know, I've been building up through life, then guess what? They're going to be times 20.
Yeah, exactly.
Right?
Yeah.
So why wait for that?
Yeah.
You know?
Yeah.
And that's one of the preventive, I would say, measures I always talk about personally.
Yeah.
But I feel like it's ignored in the industry.
Yeah, it's difficult because, you know, mental health cover in the Middle East, it's often not covered under insurance.
100%.
So for a lot of people, you know, you feel like, oh, you know, I'd rather go to a restaurant and pay for that. But what's so important about the brain is that you don't get the opportunity to like offload. You really do. The body keeps score. And so the more you accumulate trauma, which we all do of course varying extents, and the less you learn techniques or tools to manage, then it could just be a very minor thing that tips you over the edge. I often have women coming in and they're like, I got divorced when I was 25. I thought my life ended and I coped better with that than me, you know, sending my kids off to university, which is a happy thing. Like, why am I
so depressed about it?
And then you unpack that, like, actually, a lot of it is this fear of abandonment that has been unresolved in younger years. And I know some people are going to be watching this and they're going to be like, this generation is so soft. Our generation, we did it. Yeah, we did everything. But when you look at the older generations, actually, a lot of them were quite sad. Yeah. You know, they didn't communicate well. They weren't thriving in their 60s. No. And that's not where I want our generation to be. Yeah, I want us to be well-adjusted individuals that can cope with various levels of stress. So, yeah, I completely agree with you. I think I've told you this before. I've posted it on my Instagram, but I had my first pregnancy resulted in a miscarriage, and it was quite late of a miscarriage.
Okay.
And up until that point, I really felt like the medical job hadn't affected me. The trauma of like seeing death and illness hadn't really got to me. And the minute I had my miscarriage, the wheels fell off. I could not cope with the most minor things. I felt so overwhelmed. And I remember I was super fortunate that I had a bereavement midwife. And bereavement midwives, shout out to all of you. There's a couple of them in the UAE as well. Their job is literally to speak to families who have lost babies. So they're a midwife by trade. They're trained to, you know, help women through birth. But specifically this sector of women are doing the most selfless thing. They're supporting women through death and loss of a child. And I remember she called me and she was like, you're asking too much of yourself. You need to actually start being more mindful. Go out and look at the world. Stop thinking about, if I, you know, don't conceive a child in the next year, what am I going to do? Overwhelming yourself.
Yeah, exactly. Putting these deadlines.
That we put on ourselves as women. And it really made a difference. And the talking therapy that I received after it equipped me for life. I would say, you know, I took it for a specific reason, but it really helped me navigate how to communicate. And then sounds really dramatic, but when I gave birth, I lost 4 liters of blood, which for all the medics watching, they know how significant it is. It's basically like a gunshot injury. I was dying, actively dying at birth.
So sorry.
Thank you. But I was I remember when I had my miscarriage, I felt so ashamed of talking about it. I didn't even tell my friends.
Yeah.
My birth experience, I felt much more
open, equipped to
because I
deal with
knew
it.
this was not a weakness of mine.
No,
Like I had,
and I didn't cause it.
yeah, it wasn't. And actually talking about it helps other women. It normalizes that a lot of us aren't just, you know, sitting in a field with daisies and out comes this baby. Some of us are struggling
doing that.
Yeah, and so I think the brain aspect, our mental, is one of the most important, in my opinion, it is the most important thing. You could have the best physical health, all the financial resources, network of everyone, but if your mental health is
not right, you will struggle.
Khalas.
Yeah. By 50s, whatever, by the time you are fully menopausal, it's going to come and bite you. And that's what I always say. It's going to come and bite you. The earlier in life you deal with this, and there's not one person, and I will generalize, there is not one person out there that is not dealing with something.
Yeah, for sure.
Come on.
Yeah.
Come on.
And,
right?
Whether it's childhood stuff.
Whatever.
Yeah.
You know?
Yeah.
Okay. We are trying not to kill someone. Okay, great. Awesome.